What can be done to kind of resolve those issues? I want to start by saying that, psychology has come a very far way, but it's still a very different science compared to the physical sciences. For example, we know we've explored space. We know how we've mapped the genes. We've invented nuclear bombs, and so there's a lot of science that is very close to us that we could control. Yet the psychological science is still very vague. Again, the problem is that the causes of our disorders are so multifaceted. There's a biological approach, the psychological approach, the social cultural approach, that it's hard to resolve disorders kind of easily in a simple way. So that's one way that I'm going to introduce this topic. So what we're going to do today in this unit, I'm going to talk about different psychological therapies, how do we evaluate them, the biomedical therapies, and then also how to prevent psychological disorders from occurring in our lives. Okay, so how we treat psychological disorders really depends on what we think the source of the disorder is, right? So we talked about different perspectives. The biomedical perspective thinks it's a body-brain issue. The Freudian perspective, the psychodynamic, thinks it's a kind of a psyche, a subconscious conflicts issue. Behavior thinks it's just like a learning and reinforcement issue. So we're going to look at different therapies today that kind of use different methods to resolve psychological disorders. And so by changing the conditions that lead to these disorders, we could alleviate the symptoms or even solve the underlying problems. To start with the introduction of the treatment of people who are mentally ill, I want to again bring up the name of Philippe Pinel. We talked about how in the past the treatment of people with psychological disorders has been barbaric, to say the least. They were put in cages, they were treated like animals, they were kind of physically abused. The treatment involved a lot of primeval brain surgery, like lobotomies. And so the way we treated people who were mentally ill at the time was kind of disgraceful. So enter two kind of early researchers, Philippe Pinel and Dorothea Dix, who kind of advocated a more humane approach to treating patients with mental illnesses. So they set up a very medical approach, for example, using hospitals, using ideas of treatment, using the scientific method as ways to solve and resolve mental illnesses. So people today usually use several camps of therapies. The one is the psychological therapies, and the other camp is the biomedical therapies. And in that camp, they use things like brain surgery, medicine, and drug treatment to solve mental disorders. In the other side, the psychotherapy, we're more interested in using ways of changing something about the psychological process in dealing with psychological disorders. Most likely, though, if you go to a therapist today, they're going to use the eclectic approach. Eclectic approach is using, they're usually trained in multiple theories and perspectives, and they could take a little bit of both or use both to solve the underlying issue. For example, in addition to getting talk therapy, you also get Prozac and drugs on the side. And so it's a combination of these two that make the most useful outcomes.